Hi, I'm Carolyn Lauckner, an assistant professor at the University of Kentucky Center for Health Equity Transformation. I'm the corresponding and senior author for the article titled Dating App Use Among Rural Men Who Have Sex with Men and Its Relationship to HIV Prevention and Risk Behaviors, a Mixed Methods Analysis. Before I give you a quick summary of this article, I want to acknowledge the rest of the authorship team, beginning with Lauren Bino. Lauren began this article as part of her capstone project while pursuing her MPH at the University of Georgia, and she's the one who really conceptualized the entire paper. Other members of the authorship team include Drs. Danielle Lambert, Natalia Trzynski, and Nathan Hansen, who were key contributors to the research project that was conducted at the University of Georgia. So we first started this study in an effort to really learn more about the experiences of rural men who have sex with men, particularly those living in the southern United States, who have not received as much attention in research as men who are living in more urban areas. And we were interested in how they use dating apps, how they found potential romantic or sexual partners, how they received healthcare, and their HIV prevention behaviors. So we conducted a mixed method study, including a survey of 85 men who have sex with men living in these rural southern areas, and we completed follow-up interviews with 20 of these men. And what we found was that about 3/4 of all participants had used dating apps in their lifetime, and Grindr was the most popular one that people reported using. Those who had ever or were currently using dating apps had more sexual partners, but they also expressed more positive attitudes and more interest in taking PrEP or pre-exposure prophylaxis. For those who are unfamiliar, PrEP is a daily medication that you can take to help prevent HIV, and it is highly effective. But we found that only 7% of our sample had ever received a prescription for PrEP. Also, less than 1/3 thought that it would be easy for them to get PrEP if they wanted it. So during the interviews, we asked participants if they perhaps would be open to receiving information about PrEP and other HIV prevention steps through dating apps, and they said that they thought it would be a good venue for distributing educational materials. So our main takeaway from this study is that rural men who have sex with men are really underserved in terms of access to PrEP. And one way of addressing this disparity could be through leveraging these dating apps because they're used by so many members of this population. And you could use these dating apps to distribute education and access information, especially since they're associated with a higher interest in taking PrEP. So you have a favorable audience if you're using these dating apps. There have been other researchers that have recently tested the potential of apps for distributing PrEP information, but we think this study really adds to the literature by focusing specifically on rural men who have sex with men and highlighting the need for more outreach to this population. And that is my quick summary. I hope you enjoy the article. Please feel free to email me at carolyn.lauckner@uky.edu. I'm putting my email address up on the screen right now so you can see it. And I thank you for taking time to view this video. Thanks so much.